Hi, my name is Scott Grisewood, and I'm the owner of Canada's first 4YOURGAIT facility. And I'm excited today to show you how we go about calibrating gait. Hey Michelle, how you doing today?
Great, Scott. How are you?
Good, doing good. So you ready for your gait assessment?
I am, yeah.
Okay, so we're going to take you through today our standard 4YOURGAIT protocols. And we're looking for imbalances through the movement cycle and cognitive imbalances that we need to address in order for you to perform better and feel better. Okay? And so our goal is to produce measured outcomes. So you don't have to listen to what I have to say. It's all by what the data says, okay? Because I might be wrong.
Okay, good.
Okay, so we're first going to start with a very important test. It's called the Shumway Cook Balance Test. And what we do is we come up on one foot and we want 90 degrees of the hip, the knee, and the ankle on the opposite side, and put your hands up like so. And we're going to test you for 15 seconds. Okay, good. Okay. So same thing, opposite side. Okay, good. Down. Okay, so now we're going to do the same test, except with our eyes closed.
Okay.
And what we're looking for is if there's a difference between the two tests. And if there is, you have a proprioceptive deficit that needs to be addressed in order for you to improve the quality of your movement cycle.
All right. So
Okay.
start with the same like I started with.
Yes, please.
Should it be
2.
hard?
Okay. Yeah. Now close your eyes. Okay, that's not too bad.
Was that
That's
15
not too
seconds?
bad.
Holy, that was hard. Okay.
Yeah.
So let's start again.
Opposite leg, yeah.
God, which one's a little harder, right?
A little different between both feet.
Yeah.
Same thing. Okay.
It's hard.
Okay. So as our mentor would say, Dr. Gorman, he'd say that you're drunk.
Okay.
You have dramatically reduced utilization of normal kinematics, and we're going to go through the process of sobering you up.
Okay.
Okay? All right. So now next thing we have to do is we're going to input your name into the computer, and we're going to get ready to start the test. Okay?
Perfect.
Okay. So we're just going to go through the process here of inputting the patient's name and choosing our tests and running the tests. And then we'll go over the review, the results. Okay. So we go into patients, insert and modify. We get a list of patients that come up. Top right hand corner it says new patients. We're going to click on that. Last name, abbreviated. Female. Now we can go into height and weight and so forth. Typically I don't do that. Perfectly allowed to do so if you wish. Okay, so we saved that, and now we go over to test. We're going to execute the test. So up in the top left hand side here we've got our patients again, so we click on that, click on Michelle's name, and top right it says confirm, and we confirm that Michelle is our patient. And we go down to test, and we scroll through our myriad of tests here that we're able to do with the OptiGait system. And we're clicking on treadmill walking 3 miles an hour or 5 kilometers an hour. Click on that, and we confirm. Okay. Now it goes over to execute, And this window that comes up says verifying foot length. Please enter inside the bars and continue. So we're going to ask Michelle to come up onto the treadmill and we're going to measure her foot. Okay, Michelle, I just want you to stand like so just for a moment, please. And we click yes to verify foot length. Okay, and it's confirm measurement, yes. Save, yes. Direction interface side, okay. And here's where we pick a comfortable walking speed. So until we get the patient on the treadmill and see what's a comfortable pace for them, then we'll put the speed into the box and we'll move to the next step. All right. Now, are you comfortable to let go?
Yep.
Okay. Now, is that comfortable walking speed? If you were walking outside, would you be similar? Okay. So that's 2.3. Okay, so I'm going to test you for a minute. I want you to try and look straight ahead, and we can't talk during the test, okay? Okay.
Can I hang on or?
No, let go. There you go. 2.3. So we input 2.3 into the speed. Click OK. Now, in order to start the test, we have to click start when her right foot is in the forward position. So using the video, we're looking at the right foot, and when it's in the forward position, we click on start. And again, when the right foot's forward, click on start. Okay, so we know that we have this correct. When we watch the left foot, when that heel strikes, about a half a second later, the red bar comes up. If the green bar comes up, we've got our left and right foot backwards. And we would have to go over here and change it to the left foot start. So, as you can see, when that left heel strikes, a half a second later, the red bar comes up. So we're dialed in, and we're going to do a 1-minute test. And then we stop. Okay. Okay. So, you can come off and just have a seat for a moment, Michelle. Okay. So we're going to save the test. We're going to go up to results. Okay, and we need to shift the file over to from test list over to test analysis, like that. And when we do that, we can click on view, and that'll bring up the gait report. Okay. So to explain what's going on here, this graph is a step length graph, and in this test there was 119 steps taken. And as we scroll down into the report itself, on the left-hand side where these green dots are, these are the individual parameters of the gait cycle. In each one of these cases, we're measuring left and right side, and we're looking to see what the difference is. So in Michelle's case, right now, without her shoes on, she's 4.6% different. The numbers in the brackets represent variability. So CV stands for coefficient of variability, and these are the efficiency numbers. So just like the symmetry numbers, the difference, we want these numbers ideally to be under 5, because our goal in all cases is to be symmetrical and efficient in our movement. So the way the color code system works is from 0 to 5% different is a green dot. That's our happy zone. That's where we want everybody to ultimately be. Okay, so the way the color code system works is from 0 to 5% asymmetrical is a green dot. That's our happy zone. That's where we want everybody to be within. From 5% to 10% asymmetrical is a yellow dot, and that's a cautionary zone. Something's going on that we need to pay attention to. And 10% and over is our danger zone, where if that person was a runner, we would shut them down until we get the imbalances corrected. Okay, so as we scroll down, stance phase, we look at 0.2% different. CV values, both of them are under 5%. So in this case, in her stance phase, she is both symmetrical and efficient. As we scroll down into swing phase, slightly inefficient with the swing phase, but symmetrically she's fine. And it's the same with single support. So these are temporal parameters of the gait cycle, these first 4 parameters. The following 2, load response and pre-swing, are rotational parameters, and they measure how much rotation happens as we take load onto the leg. And in this case, again, Michelle is symmetrical, but she's not efficient in controlling the load response. So that's something that we would hope to rehabilitate. What that means is that she would tire more quickly than what is ideal for her. So this being a morning test, if she were walking around in her bare feet all day, we would expect the difference numbers to be higher at the end of the day because she's not efficient. Same as pre-swing. Step time is good and speed is good. So from here, what we want to know is our next test is going to be with shoes. So she's going to pick a pair of shoes. I asked her to bring the shoes that she wears the most. And we want to know what happens to the quality of the movement cycle when she puts on her shoes of choice. So the idea would be that it improves the quality of the movement cycle, not degrade the quality of the movement cycle. Okay, so we're going to go back to test. We're going to go back to execute. Execute again. Interface, execute 2.3. Okay. All right, so now we're going to put your shoes on.
Big time I can't.
The little flame hits?
My shoes?
Yeah.
I don't know. Because I can't go buy anything.
Right.
Okay, come on up. Okay, so we're going to bring it back up to 2.3. Okay, so when we put the shoes on, what I'm doing is just letting her walk in the shoes for about a half a minute, just to accommodate to the new footwear. because there's going to be changes happening. So I want to give her a little bit of time to accommodate, and then we'll take the test. Okay, same thing. When we go to start the test, it's going to be with the right foot forward. That's what this little graphic on the left-hand side is about. Our starting foot highlighted as the right foot. So we start the test with the right foot in the forward position. So again, as that left foot contacts the treadmill, about a half a second later, this red bar comes up. So we know that we're correct with right foot forward. So you want to bring your chair over here and I'll go through the results with you here. Okay, so we're going to click on save to save that test. We're going to go up to results. And we're going to shift this last test over to analysis. Now when we have two tests on the test analysis side here, the compare button becomes highlighted. So we want to compare at this stage what happened to the quality of the movement cycle when we put these particular pairs of shoes on. So we go to compare. Okay. So test 1, test 2 is right here. So with them side by side, we lose our little color code here, but we know the numerical parameters. So without shoes, her step length was 4.6% different. With these particular shoes, it came down to 0.5%. Slightly more inefficient in that movement. Stance phase, not a whole lot different, 0.4% different, and slightly more inefficient. Still in good parameters, but there's definitely a change. Swing phase, same thing. These numbers are higher, so we're less efficient, and we're at 1.5% different as opposed to 0.4. Single support, same thing, more inefficient, and 1.3% different compared to 0.4. Load response. So if we were looking at this test individually, this would be a yellow parameter, and so would pre-swing because we've gone over the 5%, and you can see with the CV values here that were less efficient, same as in pre-swing. So load response we pay attention to a lot because according to the military study there that that we go by. Load response, or high load response, is one of the #1 predictors of injury. So we're particularly vulnerable in that stage. As we take load onto the leg, our heel hits the ground, so we have ground force going up the leg. At the same time, we're transferring all our body weight down that same leg, and so we have a meeting of forces in shear. So anybody coming into the clinic with foot, ankle, knee, hip, low back, for sure, paying a lot of attention to load response, because it's step down, rotate, come off, step down, rotate, come off, and we want to eliminate as much of that as possible. Step time went out a little bit, but we're still under 5% as far as our symmetry numbers, and we're slightly more inefficient. Okay, so with this particular pair of shoes, in the configuration that she's using them, I would want to have her under 5%. So the other parameters aren't too bad from a symmetry standpoint, but we also have to work on the efficiency of those parameters. So now we're going to try another pair of shoes. So I'll ask you to go and put your other shoes on.
Maybe my sandals?
Whatever works for you. So same thing, when we change the pair of shoes, I let them walk for about a half a minute just to accommodate to that particular shoe. Are you hanging on?
Nope, I just
Okay.
saw you get up.
Okay. Okay. And we're going to save that test. We're going to go up to results. Okay. So I can either compare this test with the first pair of shoes, or I can compare it with your barefoot. So that's your baseline, is without shoes. So what I'm going to do is I'm going to take the baseline out, and we're going to compare the Nikes to, oh, they're both Nikes.
Nikes, yeah.
Okay, test 1 are the older Nikes, test 2 are the newer ones.
Okay, sorry, no, Amanda thinks I'm ready for her to come get me, but
Okay. So you can see with this, the last pair of shoes, the newer Nikes, threw her step length off to 5.3%. The older Nikes, it was 0.5%. Stance phase, she's more symmetrical and more efficient. Swing phase, same thing, more symmetrical and more efficient.
with these shoes.
With the newer shoes, and the same thing in single support. So essentially we look at these first 3 parameters as balance parameters in short strokes, basically. And then we get down into the rotational parameters. And your load response with the older Nikes was 5.2%, and it's 0.9 with the new ones. And you're much more efficient.
So a big improvement in these shoes.
Big improvement.
And I felt good walking in these ones too.
Good. Good. Same with pre-swing. Much better. Much more efficient. Could be slightly better as far as efficiency goes, but when you compare the two, 16.1, 7.2, and 15.8 down to 7.6, that's a decent improvement. But that's an example of how a pair of shoes can completely dial you right in or completely dial you out of quality movement. Step time was improved and you're more symmetrical.
So would you suggest that I don't even wear these other shoes now, or what would they be good for?
Okay, so that's a good question. People will have shoes, they're not completely worn out, so they don't necessarily want to get rid of them. So what we do is we designate them as a low step count shoe.
Okay.
So if you just have to run to the corner store or the bank or something like that, where you know you're sort of quick in and quick out,
Okay.
you know, go ahead and wear them. But if you're going to go out for a walk and you know that your step count's going to be high, or if your job entails a lot of steps during the day, so let's say you're a nurse, for example, you might put on 30,000 steps. So the higher your step count, the more important the quality of that movement cycle is.
Okay.
So we're trying to set you up for success and reduce the amount of potential for injury, and in the case of a nurse, less fatigued at the end of a shift.
Okay.
Okay, so we want you balanced and efficient.
Okay.
Okay, so by going through this test, we've determined that the new Nikes, and they're better looking too, the new Nikes are better for you than the older ones.
Okay.
Okay, so those ones, they've got a few miles on them. And again, if you don't want to throw them out, designate them for low step count
Okay.
purposes. Okay, so that's how we come to terms with identify what shoes are going to be best for you shoes.
Gotcha.
Okay, so now we determined that the new Nikes are better than the old, so let's compare your gait or your baseline to the new Nikes. So I'll pop those over there, so that's your baseline and that's the new Nikes, and we go into compare. Okay. So your step length is slightly off compared to your bare feet. So you're 4.6% without shoes and 5.3 with the new Nikes. Balance parameters, stance phase, swing phase are all improved, and they're all more efficient than your bare feet. And that also applies to the rotational parameters. You're more symmetrical and you're more efficient. Same as step time. And you're more efficient in speed as well. So overall, putting those shoes on, apart from your step length, and we'll address that with the next phase of testing that we're going to do, and we'll address your step length. Okay, so the next step that we're going to go into is we're going to address the proprioceptive deficit, and we do that with Barefoot Science. And these are the mid-arch stimulators that are going to help us rehabilitate the proprioceptive system and take you from the drunken state into a sober state. Okay, so we open them up. And we pull out the insoles. And they come with this little box, and it's got 7 different levels of plugs. They're all marked from 1 to 7. And we start at level 1. And we start by opening up the back of the Barefoot and just dropping the plug in. Like so. So through our testing, we determined that the older Nikes were low step count shoes. They're not the ones that we want to be doing most of our steps in. So we'll just put those to the side. Now, when it comes to putting anything in your shoe, the sock liner is going to have to come out of this one because it has this little bit of a ridge, a support, if you will. Doesn't look like it does anything, but if you leave these in and you put the Barefoot on top, it skews the angle of the Barefoot. It's going to post you laterally too much. Okay, so they have to come out, and the Barefoot goes in. Now, when we look inside, you can see in this particular shoe that the Barefoot will sit nice and flat. Sometimes with shoes, especially women's shoes, sometimes the throat of the shoe in this area here is too narrow for the Barefoot. In that case, we would have to trim it. So sometimes the Barefoot would sit up on this ridge here if the shoe is too narrow for the Barefoot. In this case, we wouldn't have to trim the Barefoot. It sits down flat, and we're ready to go with this one. So we're going to ask you to pop that on, and I'll get this one ready. Okay. So just to explain how this is different than an orthotic is, first of all, it doesn't have a medial support, okay? It has the dome-shaped structure in the center of the Barefoot Science. And essentially what this is doing is duplicating or mimicking walking on a natural surface. So if we had you walk across the grass or the sand, every step you take, something would be stimulating the mid-arch of the foot. So that's what the dome does, and this series of progressive plugs make that a little bit more stimulus each level that you go up. Okay? So since we're not going to stop wearing shoes anytime soon, we use the mid-arch stimulator with the Barefoot Science to mimic walking on a natural surface.
And is the idea that you work up to the highest?
Yeah, so we're going to work up to level 7. So we typically leave each level in for approximately a month. And in my practice, I have people come back 6 to 8 weeks later. And what we do is we do another test without shoes. And we compare that test to our original pre-Barefoot Science and or pre-intervention, because in a lot of cases we'll be addressing restrictions in the joints of the feet, fascia, connective tissue, all the way up the chain as part of our intervention. So this is the proprioceptive part of our intervention, and we're going to have you come up on the treadmill, and we're going to let you walk for approximately 300 steps, 3 to 4 minutes, and then I'm going to take another test, and we're going to compare. Okay, so we're going to bring that back up to 2.3. And let go, and look straight ahead. So after this test, when we want to compare the shoes with and without the Barefoot Science, just out of general interest here, and we compare. Now test 1 is without barefoots, test 2 is with barefoots. So what happens is it's about a 50-50 split in my experience as to what happens when you put the barefoots in, whether we see changes to the positive or to the negative. Either way, we've stimulated the nervous system. About the worst thing that could happen here is if we saw no change at all after we tried to stimulate the nervous system. So what happens is in the initial phases of using barefoots, when we first put the plug in, either the nervous system says, oh my God, where you been all my life? I just love it and I absorb it and the numbers get better. Or it's like, who are you? I don't know what's going on. I need time to figure this out. So like I said, either way, it shows that we've done something to the nervous system. In the grand scheme of things, what we want to know is in 6 weeks, 8 weeks, 12 weeks, when we do another barefoot test, after we've been in Barefoot Science for a couple months and we take away the shoes, we want to know if there's been lasting changes to the nervous system by doing a follow-up test. So in 2 months, if we bring Michelle back and we look at her barefoot numbers again, she'll have been in Barefoot Science for, let's say, 2 months. She's probably on level 3. And I like to test people just when they're ready to go up to the next level, not just after they've put in the next level. So let's say she's just ready to go into level 3. I want to test her before that, because as soon as we go up a level, like I said, sometimes the nervous system can get thrown out of whack to adapt to this new stimulus, or the added stimulus in this case, and it needs a day or a couple days to adapt to that stimulus. So I get a better reading or better understanding before we go up to levels and change the plugs. So in this case, we put the Barefoot Science in, and the step length went out a full percent. Efficiency numbers, thereabouts the same. And we will address step length in the second screen, and we'll go through that and we'll show how we addressed this, the step length in this case, with lifetime neuromuscular feedback using the second screen, and we'll go through that. As far as the next parameter, stance, swing, and single support, essentially again balance parameters. We can see that she's already starting to become more efficient. Symmetry wise, she's still dialed in quite well, but her efficiency numbers are starting to improve. Okay, as we go down. And when we look at the rotation, she's starting to go in the opposite direction of what we want to go. We are still, however, under 5%, but this is what I expect to see. I expect to see changes when we do something to that shoe. And again, if there's no changes, what's going on with the nervous system? Why isn't it responding to what we do? So this at first looks a little concerning because we're going in the wrong direction. But in my experience, again, this is a response to the stimulus of the nervous system. The brain is trying to figure out what's going on down there, and it's going through that adaptation phase. So we're still in good parameters, still good numbers. We are more efficient in that movement. So that's a change in a positive direction. And that follows through with step time, you're more efficient. And speed is thereabouts the same. So again, this is good information for us. Not too much different symmetry-wise, but she's more efficient in her movement when we put the Barefoot Science in. And this is just with 3 to 5 minutes worth of stimulating the nervous system. We're already starting to see changes. So before she leaves, we're going to go through the second screen, and we're going to work on getting her step length under 5% through the lifetime neuromuscular feedback process. And then again, we were going to follow up in 6 to 8 weeks, and we're going to take everything away, go back to the testing without shoes, and again, the changes that we are going to see are the permanent changes that we've made to the nervous system. Any questions?
No.
No. Okay, so they were comfortable?
Yeah, really
Okay.
comfortable.
So sometimes when people put barefoots in, they will feel a little bit uncomfortable. Sometimes they can say that there's a little bit of crampy feel in the foot. In my experience, that's usually because there is a restriction in the intrinsic movement of the joints of the feet or the fascia of the foot. So after I take my testing and we do the Barefoot Science testing, she'll go into the treatment room. I'll be checking for restrictions in the feet, ankle, knee, hip, low back. I'll address those, and we'll come back and we will go into the second screen and retrain, in this case, the step length parameter is what needs to be addressed. Everything else is under 5%, everything else is more efficient, and we will let the Barefoot Science do their job over the next several weeks, and we will follow up again with our numbers. And this is what produces measured outcomes. This is where the industry is begging to go, and with the use of accurate, objective measurement technology, we're able to produce measured outcomes. So this isn't Scott saying, yes, my patient's gotten better, and here's anecdotal evidence through testimony that Michelle is telling me, oh, I feel better, so forth. It's great that she feels better, but we also want to see it in the numbers.
And will this eventually help with my rotation when I was talking to you about my hips?
Yeah, so in Michelle's case, she's got a history of chronic hip pain. So again, back to the rotational parameters, I want to make sure that when she's taking load onto her leg, that there's not excessive rotation, that she's well under 5%. And that's our goal from a treatment to goal standpoint, is to take out the extra rotation, because every step she takes, if there's excessive rotation, it's niggling away at the hip. When it's trying to heal, when she goes out, she gets treatment. Again, if you're putting on shoes that increase the load response, it can negate the effectiveness of the treatment. Okay. One of our most drastic case studies was an Olympic snowboarder. She presented to the clinic looking for shockwave treatment, as she heard that shockwave could be a potential solution for her deep-seated anterior hip pain. She had been through all the clinicians at the Olympic Training Center with no luck as far as resolving the hip issue. And so, again, part of coming to the clinic, we go through the whole 4YOURGAIT process. And when we did her baseline testing without shoes, we found that she was in a cautionary zone. If my memory serves correctly, she was about 6.8% rotation without shoes. And then we asked her to put on the shoes that she wore the most, which happened to be the shoes that she was training in. And her symmetry numbers went from 6.8 to over 45%, and the efficiency numbers, the CV values, went from under 15% to over 100. So in her case, the clinicians that she was seeing at the Olympic Center could very well have been giving her a treatment that would have shown progress, but the minute she put her shoes on, it completely went sideways for her because they were absolutely the wrong pair of shoes for her. So when people ask, what shoes do I wear? In this case, Michelle came in. The first pair of shoes weren't the best for her. The second pair of shoes was much better. And that doesn't always happen. Sometimes we can go through 8-10 pairs of shoes, and none of them are better than her barefoot numbers. And so experience of doing thousands of gait tests and shoe tests is that there's no way for a human to be able to predict what shoe or type of shoe is good for that particular person. And it certainly doesn't come from watching somebody walk down the hall, right? You can appreciate with all these numbers that there's no way a human can be able to spit out these type of parameters and say, oh, your gait is off by 6.3% just by watching you walk down the hall. And there certainly would be no way to indicate how efficient that movement is by watching somebody walk down the hall. Personally, I don't care how many designations are behind a name. It's the fact that a human eye cannot see these asymmetries anything below 15-16%. Okay, so we are putting movement under the microscope. We're getting into the realm of assessing and measuring that the human eye is incapable of doing. And this is how we're able to clean up the imbalances of our movement cycle and see people have longer standing results and better performance. Okay, so we just finished Michelle's gait test with these shoes on, and what we've determined is we've got an issue with our step length. So it's in the cautionary zone. It's not crazy, but it's to the point where we need to address it. So it's at 6.3%, and we want to tighten that up and bring that to under 5%. So we're going to show you how to do that. We go over to Biofeedback, Treadmill walking test, and we're going to show you how we get the brain to communicate with the muscles more symmetrically through lifetime neuromuscular feedback. Okay, so when we start the second screen, we have to use the same speed as we did with our gait test. So in this case, it was 2.3 miles an hour. So we bring that up to 2.3. And I always let them walk for about 20-30 seconds just to accommodate to the moving treadmill. And then we go into our test. So we're in right now what we call the second screen, and this is where we do the lifetime neuromuscular feedback. It's a process where we're teaching the brain to communicate with the legs in a symmetrical manner. And so each of these vertical bars represent left and right leg, and the numbers above it in the color pattern tells us how different they're operating. So the idea is that we want to be in the green zone, not the yellow or the red. So when one vertical bar is coming in lower than the other, we need to reach farther, in this case with the left leg. Is her left leg, now she's becoming, right? So as she's trying to adjust, you can see the other side starting to come down. And she's going through the process right now of trying to find what's equal. And this is to be expected, especially the first time that we do it. But it'll become the norm once she spends more time working through this process with this live time information telling her what's equal left and right side. So in this case, we're working on step length, but I could change that parameter to stance phase, swing phase, single support, load response, and then we would have to give the directive to change each one of those parameters. But each of the parameters, each of the phases of the movement cycle can be addressed in the second screen through lifetime neuromuscular feedback. So in this case, she's right now been running for 7 minutes and 32 seconds with some directive in there. So I'm going to stop the test and I'm going to show you the pie chart, and this is what we use to know over time how effective the training has been. So, okay, so today, in the 7 minutes and 30 seconds of this particular exercise, she was in the ideal parameters, so under 5%, 48% of the time in that 7.5 minutes. So today we would chart that, how much percentage she was in yellow and red. And so the next time she comes in, we're going to try and improve on these numbers. Okay, so again, it's a learned process. Some people struggle a little bit more than the others, but it's a process where we can objectively measure left and right leg and improve on the symmetry of left and right leg. And that's how we use second screen.
When I'm doing this at home or on the waterfront, though, how am I remembering?
You can't.
Okay, I have to learn it kind of here.
Yes.
And then it just becomes.
Yes.
So that's not that bad, though, is it?
No.
Okay.
So for your first time around, that's not bad, you know?
Okay.
Practically half the time of that test.
Okay.
It's the first time you've done it, and your brain is going through that learning process. So I'm sure you can agree that when you were doing it and one side you needed to reach farther with the other,
Sure, yeah.
your adjustments initially were too much, so it threw the other side off.
Mm-hmm.
So then your brain has to fight for finding what's
The balance, okay.
equal. And again, that's a learning process. It doesn't happen overnight. But it certainly doesn't happen when we don't have technology to use it. We'd never be able to gauge what's equal left and right leg without the OptiGait system. Okay, so to start the second screen, we go through this process. So we're going to ask Michelle to bring the treadmill up to 2.3. Tell me when you're there.
I'm there.
Okay. Okay, so when we open up this window on the right-hand side, we've got two flashing feet, and what we have to make sure is that we're matched correctly. Because if we are backwards, when the vertical bars come up, we're going to be reaching farther with the wrong side. So we just check, in this case I just checked to see that when the red foot is illuminated, the left foot is the one that's making contact with the ground. And we need to make sure that we're at 2.3 miles an hour, so we've dialed that in. And then we can start the test. Okay. And I just want to show here that in this case with Michelle, we're working on step length. But we could also, if she had other parameters that were in need of work, we can rehabilitate those as well, whether it's free swing, step, speed, and so forth. Okay. The other parameter that we can change is that we can turn this into a version for kids that's more engaging for the children. And when we do this, the image changes. So instead of having two vertical bars, we have a mountain. And we've got a little monster here that when you're at 0% asymmetry, you're at the top of the mountain. So the idea is to keep the monster at the top of the mountain. If he's coming down the left-hand side, we need to reach farther with the left leg. If he's coming down the right-hand side, we need to reach farther with the right leg. So right now, she's dialed right in to being symmetrical because the little monster's happy at the top. So it's a little bit more engaging for kids, and we're still doing the same thing, it's just a different graphic. Okay, so the one thing I really like about the OptiGait system with regards to gait analysis is that it allows us to go into the second screen and actually change the way that we walk in whatever parameter needs to be addressed. In Michelle's case, it was step length that needs to be addressed. But to have the ability to use lifetime neuromuscular feedback, our testing equipment then becomes our training equipment. So that's an attribute to this system that is, to me, invaluable because we get to the root cause of the imbalances in our movement cycle. When you first do it, you tend to overthink it.
Okay, yeah.
Okay? You're really trying hard. What we see is people get their face tied up. We call it faces, right? They got some kind of face going on because they're trying to make this happen. And so sometimes when you try too hard, it's more difficult. But that's again part of the learning process where you're grasping at what makes this level, what makes it work. And sometimes when you just close your eyes and just let it happen naturally, you'll start to see an improvement in it.
Yeah.
Right?
Yeah, because I thought you were totally just showing that as an example, and I'm like, I'm at the top.
Yeah, you're at the top. So again, after you get the brain working in a symmetrical manner and you kind of just let it go on its own, oftentimes we come right back up into a symmetrical range. Yeah.
Cool.
Yeah. So this is how we retrain people how to walk.
Mm-hmm.
Right?
So is it just habits that make people not walk
Oh,
right?
it's habits, it's prior injuries. It can be, if somebody had for example, somebody with a plantar's wart, okay, and they're limping, and that wart has been painful for X period of time, right? We adapt a compensatory way for the brain to talk to the muscles to avoid that painful part of the gait cycle. So the more often we do that, that altered gait pattern gets ingrained into the brain. The brain thinks that it's normal. Okay? And so we have to retrain the brain to see what is normal, to feel what it feels like to be normal. And then over time, with training, it becomes our norm. The other things that can throw out step length for sure is potentially a concussion.
Oh, okay.
So we know what happens to a boxer when he gets knocked out. They don't walk out of the ring the same way they walked into that ring. So that's a mechanical trauma to the brain. We know what happens when there's a chemical irritant to the brain. We drink too much, okay? Somebody who's well drunk does not walk the same way as when they're not. So our awareness of foot placement is compromised, both with a mechanical assault or a chemical assault to the brain. So this is our way to objectively retrain gait. Instead of watching somebody walk down the hall and assuming what we know what can improve that gait.
Yeah. I know I used to say that to Amanda, just watch me walk and tell me what am I
Yeah.
doing wrong?
So after using OptiGait, to me there is no doubt in my mind that a visual gait analysis is completely invalid.
Right.
I don't care how many designations somebody has behind their name, the human eye simply cannot see what we can see when we put movement under the microscope.
Okay.
So walking through those 97 beams of light, every time you break those beams, it's gathering that data, putting it through the algorithms, and spitting us out the results in immediate time.
Right.
Okay, so one thing I just wanted to hit on when it comes to rehabilitation of the foot. A lot of clinicians right now are getting very specific with different foot activation exercises, mobility exercises, and that's great. Personally, I don't disagree with them at all. I think they should. A person should be assessed to see if they can perform those particular movements or exercises. But one thing that's not taken into consideration, and it's because people don't have the technology, is the fact that yes, these exercises are good, but they're not taking into account how they work in concert with each other. And that comes with being able to read the movement and how well do these muscles integrate with each other synergistically. And that's where the lifetime neuromuscular feedback component, the second screen of the OptiGait system, comes into play, because we're teaching these muscles how to get along together, not just be able to activate given muscles individually. And again, it's not that there's no therapeutic value in being able to do that, but we're going beyond that step into the use of technology, and we're teaching through lifetime neuromuscular feedback, through proprioceptive rehabilitation, a way for these muscles to work together synergistically. And that, I think, is one of the main components that's missing in a lot of people's treatment plans right now, is to measure objectively and be able to actually change how the brain communicates with the musculature through lifetime neuromuscular feedback and being able to monitor it with the OptiGait system. So just to recap, what we're doing is we first start with testing. In this case, we're using the OptiGait system. That finds the imbalances in the system that we're looking for. Then we go to the intervention stage, where in this case we were using Barefoot science to rehabilitate proprioception. In my 4YOURGAIT facility, I also use shockwave, microcurrent point stimulation, and functional chain trainer. And then we go back to the retesting phase. And this is where we are able to provide measured outcomes based on the interventions that we've applied, whether it's manual treatments, exercise, so forth. And that tells us whether our choice of intervention is been an appropriate choice for that particular individual. So like we say, the people that use measurement technologies, if you're not assessing, you're guessing. So it's not good enough for me to hear the person say that they feel better. I want to know that they're functioning better. And I want objective evidence, because I don't expect anybody to believe what my personal opinion is. I want to be able to give them a piece of paper and say, here's the quality of the gait before intervention, here's the quality of gait now, and it's objective. Okay, so the OptiGait system, we can test gait, right? So we can also test running. These bars will come off the treadmill, and we can do other types of tests with it. So we can test a number of things. We can test balance with it. We can test auditory and visual reaction times with it. and we can test individual leg function with it. So we do a test called a drift protocol, where we're jumping up and down on one leg 5 times in between the bars, and it gives us individual leg data, like flight time, height of the jump, area used, power, and contact time. So contact time is a specific interest for sure for runners, because that determines how long the foot is on the ground for. So when it comes to runners, I always use a simple math where if we determine that the foot's on the ground for a half a second, that's 500 milliseconds, which is a long time. So with the proprioceptive training, and the balance training, the gait retraining, we want to be able to improve our contact time. We may determine that we may have to do some plyometrics on top of the proprioceptive rehabilitation to improve our contact time. So back to the math. If our contact time is 0.50, 500 milliseconds, and we were able to decrease that by 2.50, that means our contact time is a quarter second. In that scenario, every 4 times that our feet hit the ground, we're to the finish line 1 second sooner. So how many times is that going to happen? Every four steps in a 10-kilometer race, for example, those seconds start to add up. And so for people who are competitive racers, contact time is a huge parameter that is worthy of our attention.
I totally got that.
Okay, so if we're dealing with insurance cases, right now, certainly here in Canada, the insurance providers are asking for measured outcomes. And so that does not mean a clinical opinion or personal experience or anecdotal evidence. It requires objective data. And so here, my clinic, I'm able to produce measured outcomes using objective data gathering equipment technology. So the insurance companies want to see that there's change to that person. They don't want to guess. They don't want my professional opinion. They don't want anecdotal evidence from the patient. They want to see measured outcomes. So in this case, if Michelle's insurance company was asking me for measured outcomes, I could produce that and send them the gait reports of all the testing that we've done, whether it's balance testing, gait, running, and so forth. And that's what they're looking for. Yeah, so the OptiGait system has been used in over 960 peer-reviewed studies as the measurement tool for gait, whatever intervention they were using, but it's been used in 965 peer-reviewed studies. It's also accurate to the millisecond. So again, compared to the human eye, there is no comparison. To the point that the doctor that co-developed this has offered a $1 million reward for anybody who can produce an accurate gait report visually that concurs with the gait report of the OptiGait system. Okay, so we just wrapped up our work with Michelle, and everybody got to see the whole process from front to back on how we assess the movement cycle, what our interventions were, and what our treatments were. So I hope everybody enjoyed it, and if you have any questions, send it down below.